I'm going to start with the first question, which is how you know when there is a need for adjusting your medications. Some of the principles that we are discussing here also apply to when you actually start medication or when you need to start medication by the same rationale. The first thing that I'd like to address is that the need for starting medications or adjusting medications is determined subjectively by the patient based on disability from Parkinson's symptoms. It is not an absolute threshold. The same degree of motor dysfunction or deficit, such as tremor, akinesia, which is lack of movement, bradykinesia, which is slowness of movement, or stiffness, can be disabling in one person and not so disabling in another one, depending on what they do. In a busy professional who is engaged in daily work, having professional meetings, may be bothered by a little bit of a tremor and needs to have that addressed as aggressively as possible, whereas in somebody else who is retired, stays home most of the time, and follows a relatively relaxed lifestyle, the same amount of tremor may not mean disability and may not require changes in the medications. We are going to discuss here medication adjustments that are typically upward, meaning increasing medications or adding new medications as opposed to reducing medications. Reducing medications usually is needed when you have side effects, and we are going to address that in the third question today. Parkinson's disease is a relentlessly progressive disorder, and therefore continuously we need to respond to the progression by adjustments of medications. Again, the most important element is the degree of disability that you personally experience and perceive. You need to discuss with your doctor what the disability is, and your doctor will help determine if that disability truly is coming from your Parkinson's motor symptoms or it is related to something else. Also, if the Parkinson's produces the symptoms that disable you, whether these are symptoms that are likely to respond to medication changes or not. These are questions which only your doctor and you can decide, but it is you who should determine whether your degree of disability is at a point where it needs to be addressed by adjusting your medications. In terms of adjusting your medications, once you had your discussion with your doctor, it is very important to know that these are only symptomatic treatments. Therefore, do not pursue changes or adjustments in medications believing that the natural course of the disease may be affected by such changes. As far as we know, and based on the evidence that is currently available, all the medications that are available for Parkinson's disease are purely symptomatic, meaning they address symptoms, they reduce symptoms, but they do not affect the natural course of Parkinson's disease.